Dr. Vishweshwaran is a lead consultant in clinical and interventional pulmonology in Yashoda Hospital, Somajigura in Hyderabad. Doctor, for those new to this, what are the early signs of lung cancer?
Yeah, so this is one another important problem which we are.
I'm glad we're doing this awareness session because once India is completely educated on this, the numbers will definitely go down.
Yeah, we hope that it really happens, and only time can say that.
Dr. Vishweshwaran, can you please throw some light on the common myths around lung cancer?
Yeah, that's again a very interesting question, and
where we are going to dive deep into your health and wellness. Today, we have with us our exceptional guest, Dr. Vishweshwaran Balasubramanian. Dr. Vishweshwaran is a lung specialist who has done his MD and DM in pulmonary medicine and clinical care. He's also secured a gold medal in pulmonology and critical care medicine. He's done his fellowship in advanced interventional pulmonology from Malaysia. And he's also a fellowship member in sleep medicine. Currently, Dr. Vishweshwaran is a lead consultant in clinical and interventional pulmonology in Yashoda Hospital, Somajigura in Hyderabad. I'm glad to say that today, Dr. Vishweshwaran is here to share his wealth of knowledge with us that can transform lives.
thank you, Ms. Mehana, for the kind introduction. It's nice to meet you.
Doctor, for those new to this, what are the early signs of lung cancer?
Yeah, so this is one another important problem which we are seeing rampantly amongst patients across all age groups.
Yes.
So previously we used to think that cancer, lung cancers especially, we used to think that it comes only in smokers or people who are aged. But contrary to the fact, now we are seeing many patients with lung cancer even at a very young age. We have seen lung cancers coming in a patient who is hardly 20 years old or even 30 years old and who is not even a smoker. So this is where we say that many of these cancers can have some sort of a genetic predisposition. That means genetically these patients are at a higher risk of developing some sort of a lung cancers. So identifying lung cancer at an early stage is very important, because if you identify lung cancer in the stage 1, then you can even cure these patients of lung cancer. Whereas if you are going to identify this patient at a stage 4, then probably the survival is going to be very less. So how are we going to really identify these lung cancer early? The most important thing is awareness amongst the patients. If you are suffering from a cough which is lasting for more than 2 weeks, be it a dry cough or a wet cough, it is something which is abnormal. It can be because of certain infections like tuberculosis, or it can be even because of lung cancer, or it can be of another condition called as an ILD. Or if you are a smoker and you have a cough, it can be either because of your cancer or it can be because of a condition which we call it as COPD. Apart from that, the most important warning sign of a lung cancer is what we call as coughing out blood. So any cough which is associated with blood should not be taken lightly, irrespective of the age. It can be because of cancer. And if you have an unexplained fever, or if you are persistently losing weight, or you have a loss of appetite, which means you don't feel like eating, then these are the signs which may indicate that you may be suffering from a lung cancer, but certain other conditions are also there which can have the same symptoms. Apart from that, if you have some sort of an unusual persistent chest pain which is not getting relieved by medications, or you have ruled out the heart related causes of chest pain, then there can be fluid in your lungs, or there can be because of cancer which is eroding your chest wall also. So if you have this bleeding while coughing or persistent chest pain, then these are the signs which the patient has to be, symptoms which the patient has to have a suspicion that he or she may be suffering from some serious health problem. Apart from this, as we see a lot of these patients who come to us, apart from smoking, even any other forms of non-cigarette smoking like vaping, or even for that matter electronic cigarettes, all these things are also associated with a higher risk of cancer. So any form of smoke, be it a hookah or be it smoking, or be it an e-cigarette, or vaping, is injurious to your lungs and it can increase your chance of developing a lung cancer. And one another thing which is very, very common in India is they come to us and say that they don't smoke, but when we take a history, they'll be using this biomass fuel for cooking. For example, if you are using a wooden stove or if you are using a cow dung for burning, these also contain certain chemicals which are injurious to our health and can increase your chance of cancer. So having a high suspicion is important to identify the cancer at an early stage, and if you have any of these symptoms, do consult your pulmonologist at an early stage so that they can pick up the lung cancer at a very early stage and can provide you a treatment with a good cure as well.
Thanks for sharing that, doctor, because awareness can really make a great difference in early diagnosis and treatment to actually save lives of millions.
Yeah, that's true. So India is one of the nations which has got the highest incidence of lung cancer. And even if you see, the non-smoking lung cancer also is very high, as I said to you, because of this usage of this biomass fuel, the wood and the other stuff as a fuel for cooking and for burning stuff. So we need to have a very high suspicion and we need to diagnose it at an early stage to provide a good quality of care.
Yes, I'm glad we're doing this awareness session because once India is completely educated on this, the numbers will definitely go down.
Yeah, we hope that it really happens, and only time can say that how well the awareness can bring about a change in the habits of the patients.
Absolutely. Dr. Visweshwaran, can you please throw some light on the common myths around lung cancer?
Yeah, that's again a very, very interesting question, and I feel like many of the information which the general public have about lung cancer is a myth. The first and the foremost thing is only smokers getting lung cancer is a myth. As I said to you before, we see a lot of patients who don't have any history of smoking, still they suffer from lung cancer. This is because they can have a genetic predisposition, or they may be exposed to indoor and outdoor air pollution, or even because of certain chronic infection. So cancers can occur, lung cancers can occur even in a non-smoker. That is the truth. The second important myth which people believe is cancer occurs only in aged population. Again, that is false. As I said to you before, we see lung cancers even in patients who are like 20, 30 years of age. So lung cancer can occur at any age group, and if a patient is having a chronic cough or bleeding while coughing or difficulty in breathing or loss of weight, loss of appetite or persistent fever or unusual chest pain, then you need to get evaluated with your doctor because it may be a sign that you may be suffering from a lung cancer. And the third important myth is once you are diagnosed with a lung cancer, there is no cure. That is again a myth. We see in lot of televisions and in media, in movies showing that once a patient is diagnosed with lung cancer, there is no treatment and patient generally dies. That is not the case. Now we have lot of advancements in the surgery as well as in the medical management of lung cancer. If you find a lung cancer in stage 1, you can even give treatment with a curative intent, which means that you can even go to the extent of even curing these patients from lung cancer with very minimal recurrence. But unfortunately, if we diagnose lung cancer in stage 4, still the patient lifespan can be extended and they can be given a good quality of life with the available medical advancements. So once you are diagnosed with a lung cancer, don't panic. There is a treatment for lung cancer and it can be given effectively and it can improve your quality of life as well as your duration of your lifespan. The fourth myth is, I am a smoker, I quit smoking, now I am vaping, so I don't have a chance of developing lung cancer. The answer is absolutely no. It is again a myth. Even vaping contains chemical products which when inhaled inside the lungs can increase your chance of developing lung cancer. Apart from vaping, any other forms of smoking, like even a hookah smoking, can expose you to the chemicals in the smoke which can increase your chance of lung cancer. So smoking hookah or vaping is not a substitute for your smoking. The best way to avoid a lung cancer is to stop smoking. So there are so many myths around. I have just quoted a few of them. So I think once you have any doubt about a lung cancer, it is always advisable to approach a qualified person rather than believing in the rumors that you find in the social media as well as in the movies and serials. So it's always better to take the information from a qualified person. So once you don't have the myth, then that is where you actually take a proper care and get yourself prevented or treated for lung cancer.
Yes, that's so true. In fact, I feel like it's so vital that we clear these misunderstandings because knowledge is power and it can actually help to save lives.
Yeah,
Thank you for
true.
that.
We see a lot of advancements on day-to-day basis in the diagnosis as well as in the management of lung cancer. So if you go back few years back, all that we had was an X-ray, and in X-ray, the doctor will say that he is doubtful of lung cancer, and patient also will stop the evaluation there, thinking that there is no cure for lung cancer. They go back, and unfortunately, many of them don't receive the care. But the scenario as we speak on 2024 is not like that. You have very good technologies to diagnose lung cancer at a very, very early stage and treat them effectively, and you can even provide a near total cure for this patient. So when we speak about the diagnosis of lung cancer, one thing that has revolutionized the diagnosis for early diagnosis and management of lung cancer is CT scan. So if your doctor has a suspicion that you may be suffering from a lung cancer, he may ask you to undergo a CT scan, and in the CT scan can guide your doctor in understanding whether you are suffering from a possible lung cancer, and to a certain extent also to understand what is the stage of your lung cancer. But however, for a proper staging, he may ask you to get other advanced modalities like a PET CT scan to see where all this cancer has spread apart from your lungs. Sometimes he may ask you to get even an MRI of your brain to see if this lung cancer has gone to the brain or not. In addition to this, there is a new concept which is developing, which we refer to as a low dose CT scan. Let's say that you are a chronic smoker. You don't have symptoms of lung cancer, but still if you want to pick up the lung cancer at a very, very early stage, your doctor may ask for a low dose CT scan where the radiation will be much lesser in comparison to your traditional CT scan. Yet another advancement which has actually revolutionized the field of lung cancer treatment as well as management is bronchoscopy. This is what we refer to as an interventional pulmonology domain. So just like how if you have an ulcer in your stomach, they pass a tube into your stomach to see what it is. If they want to see your windpipe, so then they pass an instrument called a bronchoscope and see if there is a tumor inside your windpipe or not, and it also helps in taking the biopsy and getting a diagnosis on table. In addition to this, there are certain other advanced modalities like what we refer to as an EBUS or an endobronchial ultrasound. Let's say that the cancer is there in your lungs, but it is outside your windpipe. Still you can take biopsy from these nodes or from the masses without even subjecting you to a major surgery to get a diagnosis. In addition to this, let's say you have a fluid in your lungs. You can easily undergo what we refer to as a thoracoscopy, where we put a camera inside your chest wall without taking you for a major surgery to take a biopsy to confirm the diagnosis as well as to clear the fluid from your lung. Apart from this, there are various other advanced technologies which have come, and luckily we are working in such a center where we deal with all these patients and on day-to-day basis. Like even if cancer is there like 1 centimeter, previously these tumors cannot be biopsied. Right now we have certain advanced modalities like what we refer to as a navigation bronchoscopy or a cone beam CT or a radial EBUS to take a biopsy even if they are less than or equal to 1 centimeter in size. In addition to this, we may also see in the near future the upcoming of the robotic bronchoscopy. Just like how you have a robotic orthopedic surgeries, likewise you can have a robotic bronchoscopy to diagnose these cancers at a much earlier stage. Already we are having access to the robotic surgery. So if let's say that you get diagnosed with a lung cancer, instead of making big scars onto your chest, you can just put 1 hole or 2 holes, go inside, do a robotic removal of the tumor, and the patients are generally sent home the very next day or 1 day later. So the field of interventional pulmonology, especially in the diagnosis as well as in the management of lung cancer, has improved tremendously. So once you have a lung cancer, do consult your pulmonologist. He will guide you the proper test to diagnose the lung cancer at an early stage as well as provide an appropriate cure.
Thank you so much for sharing these valuable insights, Dr. Visveshwaran. Honestly, I'm sure we all have learned a lot on how to take care of our lung health and sleep, because that is the need of the hour today. Thank you for that.
Thank you.
For all our dear viewers, if you have any queries or if you would love to get in touch with Dr. Visveshwaran, you can follow the link below.